that accept individuals without no insurance. That is another barrier that we have seen. And the other one is no support for chronic illness. Undocumented individuals, they can go to a free healthcare provider center, but just for primary needs, not for chronic illness.
Yeah, quickly, because a lot of them mentioned, I'd say we had not to put it all on the people, the healthcare system is just super confusing, right? Like the American system is not in any way intuitive. It's very different from what people are used to, so that sucks. Also, there are things like, is anybody Indian? So I grew up like watching like Indian TV, like in the, so I feel like you don't gotta vet a lot of stuff. There's a lot of people out there saying like health information that is not really true, like with a big platform, right? And then you start getting these ingrained notions of you take this whenever you have this issue for this. So then getting over that is really, really difficult for some cultures, so that's important to think about. And then say, well, some specific ones, religion matters. And that really matters in healthcare and a lot of different religions, specifically to speak from a Muslim perspective. Say I know people who stopped taking pills that the doctor gave them because they found out that they read an article about gelatin being used in the creation of the pills, and then they don't eat gelatin, we can't do that, so then they don't take the pills, which is not the right solution. However, that happens, right? Or some sisters who refuse to go to this particular clinic, although that's the best clinic that has the best care, however, they don't have an option for a female Stafford to work with them, right? So then they will not have a male doctor do that particular checkup, so they'll just not show up, right? So, and there are other religious kind of barriers and backgrounds that a lot of people will not get the care that they need because of some assumptions regarding religion that may not be true, or just the institution not being, culturally competent or religiously aware of like what they need to know to work with this particular population. So then, after one bad experience, they never come back despite needing that care, and they never take the medicine again or anything else besides, despite it being crucial to health, right? So.
All right, thank you so much. And I feel like we can go on and on. So, but let's give people time to ask questions, and maybe that's going to help to understand some of those questions. Yeah, so we can go ahead and start questions. If you have a question for all of them or either one specifically, just go ahead and we'll get the microphone to you. Any question?
Thank you. What is the biggest issue you seem to have in dealing with the large organizations who give healthcare to value something like cultural competency, or like what are the big barriers you see in getting that accomplished? Thank you.
So the biggest issue that people deal with a big network, right? While they're looking for care. Is that it? Yeah.
All right. One of the things I would say, particularly with most of our community members at the beginning, was the language. Most of these health care services, sometime back they don't have really interpreters. So that becomes an issue. And then another thing also is cultural competency. Some of the staff within these health services, they are not really culturally competent. They are not trained on how to deal with people from other cultures. So that causes a lot of barriers or issues.
I will talk personally in this question because in my country the system is public, so it's easier. You have an illness, you go to the hospital and they take care of you. Here is a different system, it's private, and sometimes it's very hard to find the information you're looking for. So I have a son and I've been dealing with, because he has a chronic illness, and just to understand that I couldn't, because he has a health insurance from the government, so I couldn't have an appointment for a psychiatrist, for example, because they didn't accept my health insurance. And that was very hard for me to understand how the different levels of, health insurance and where you can reach with the health insurance you have. So just understanding the system, how it works here. I'm talking as a Vanya in this case because I've been crossing that.
Okay, I think understanding the different parts of, that there's different parts of the system, that everybody's, not one office is does everything, right? And then that gets really confusing. So explaining that to patients who don't know the system is really important. Also, I think that I've seen a lot of good steps in terms of HR departments, receiving the right training, or people higher up getting the right training, but is there any, does that really go down, to the rest of the staff? And if so, is that even part of performance reviews or evaluations? Is there any feedback mechanism that ensures that that's working? That's the thing, right? So you can throw a training out there to say that you did it, and then you can create change within your organization, right? They're two different things, they have different processes. I see a lot of the former, so that's not great. Another thing just to note is that, my community, xenophobia, racism, Islamophobia, these things are real concepts, right? So say if only 40% of the American population has a positive view of Muslims, there's a good chance that we're going to hit somebody who works at your system that just is Islamophobic, right? Or racist or whatever. So that's also a barrier, realistically. So if you see how widespread these sentiments are, if recent elections haven't shown us that, or marches and rallies we've seen, that's at the ground level of patient interaction. That's a reality, right? And then how you can deal with that and ensure that's not a real barrier for people to get care is important to note, because a lot of people will come up and say things, about a negative experience that they had within the healthcare system, and it's not at all within the values stated on the website of the organization. However, at the staff level, they may have run into somebody. So how that gets resolved and dealt with is important, and we have to understand that it's statistically that exists within your organization, right? Just how do you ensure that it doesn't come into the workplace, which is the real challenge here, as opposed to changing words.
All right, thank you very much. So just to sum it up, it's some of the things that everybody here knows. It's language access, it's cultural training, it's navigation. Just even for anyone sitting here, navigating the health system is hard as it is for Americans. So when it's someone new, that's even more challenging. So let's see if we can take maybe one more question.
If no one has, I have. I will.
Thank you very much, the panel, for the presentation. Yeah, my name is Abby Honda, and I do work with the Black immigrants. I do some research with them. Yeah, my question is, how do we connect with all immigrants? Because we have some main immigrants that we know about, but there's a lot of immigrant population that they are very invisible. A typical example is I cover the Black immigrants. We have the Caribbeans, a lot of Caribbeans in Pittsburgh. Nobody even knows about them. They're not connected to anything, they don't have any group. Whereas we have the other immigrants, other Black immigrants, maybe the Nigerians, the Ghanaians, the Liberians, the Congolese, they do have their hometown groups that you can at least access. But you have some that you don't even access. A typical example is Ugandans. We have Ugandans here in Pittsburgh, but they don't have a group. So my question is, we have a very, very diverse group of immigrants. When we're talking of the Latinos, we're talking of the Black immigrants, we're talking of immigrants from the Middle East and all that. So there's just pockets of immigrants. So that's why we just can't reach everybody. There should be a kind of system to be able to reach all immigrants, to be able to provide services. And that's not really happening. majority of the immigrants here in Allegheny County are not reached at all. And they're really going through a lot of challenges.
I wanted to tag team one last question, if possible, as part of this theme of also for people who want to get trained in healthcare systems, and I'm pretty sure you all know people we mentioned who wants to go into nursing and all the other things. Just a couple obstacles that you guys have heard that they face, so that we can have some feedback from you guys what to do next for those people.
So if you guys can try to just combine the two questions. One is like how to connect with the immigrants in general, especially the ones who don't have a specific community organization. Then the challenges for people to get into the healthcare field.
I think connecting to immigrant groups is a challenge because some of them are not organized, but one would suggest that there are other organizations out there that work with different groups, probably connecting to those organizations. For example, the Latinos, if you go to the Latino Community Center, they should be able to direct you where the Latinos are. If you want to meet maybe Ugandans or you want to meet Ethiopians, you have to probably, if you ask some of us in UAC, who should be able to direct you to who maybe is the one that you can contact within that group who are not really organized. So connecting particularly with programs like ISAC, they work with ISAC is Immigrant Service